Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Welcome back to the Sit and Stay podcast, brought to you by RipsyTech. You're joined by RipsyTech product manager, Parker Anderson, and RipsyTech founder and CEO, the magnanimous Tom Tarshis. Hi, Tom.
Hey, Parker. Good to see you. Nice adjective.
Thank you. It was the second adjective that came up on the list that I had ChatGPT generate for me about 5 minutes ago.
Wow.
I said, what would be a fun adjective to use to describe my boss? And that was the second one. First one was fearless.
What was number? Oh, okay. That's better than like sociopathological or anything like that. So.
Unflappable, indomitable, venerable. Some good ones in there. Well, anyway, back to the podcast. So, yeah, we wanted to talk about a pretty big topic, one that I feel like we both maybe have some thoughts on, kind of in some of my own digging into coming up with the questions. It kind of raised some thoughts of my own in regards to some things I learned in my own grad school education. And so that is, we want to talk about open notes and this concept of open notes and this initiative to make notes, medical notes, available to be seen by the patients who are being treated, whose services are being rendered. So, rendered on. So let's talk about it. You know, you're the expert in the room, so could you walk us kind of through the a little bit of, you know, what is open notes, what's the history of it, who championed it, and you know what's the hope to accomplish here?
Yeah, and it's a very interesting topic that elicited a lot of reactions from all medical professionals, and the basic idea is that everything written in a patient's medical record, is that private and confidential? Who owns that? Should the patient be able to see it? And going back through, the history of medicine and time, essentially it was these records that were kept by doctors and hospitals. And really, as a patient, you didn't have access or easy access to what was written there. And there's even, it's such a big part of our American cultural phenomena. I think like it showed up on Seinfeld once, I think when George was seeing a physical therapist or medical professional and being difficult, and they pull out the chart and are writing stuff about George in it after his behavior, and knowing that he won't be able to see it, and it's sort of this, what are you writing? So it was this very kind of secret, what actually are those people saying about me in these records? And then, for mental health in particular, and whenever there's a therapy relationship or a psychiatrist, it's sort of this extra layer, given the origins of psychiatry and analysis with this very, secretive, what goes on behind the door, what are you allowed to say to your psychiatrist, with stigma and mental health. So in general, there was already this kind of what is being written in my medical record. And then there's this extra layer of, whoa, what does my therapist or psychologist or psychiatrist write about me? And so that has been such a part of fabric and culture for everyone throughout all of their training, that's kind of behind what elicited this elicits strong reactions on this topic. I'll say that, so it was April 5th, 2021, when the kind of federal requirement, that was the federal requirement date that all patients have access to their medical records. And this was based on, so the first patients to have access to their records were actually patients of the Veterans Affairs, the VA system. And for all the things government doesn't do great, the VA system was actually one of the first systems to have an electronic health record that wasn't fancy, but it had kind of, the interface wasn't too bad for just having a blank screen to do your notes and for having, shared information on patients, which we know between primary care or specialties kind of improves outcomes. And then what happened is they did a sort of some, quasi-experimental, let's take a group of people, providers, primary care providers really, and let's see how it goes with this project to share all medical records with patients. And that began a decade or so before this release date. And what they found actually was, patients who didn't understand directions at the end of a primary care visit were able to go back and read, oh, wait, this is how I take that medication. Any fears about something awful happening with patients having access to their records. Now, again, this is primary care initially. Right. None of that happened. And so it did improve outcomes. The providers who took part as this pilot group, none of them wanted to rescind their patients' abilities to read the notes. And so it didn't cause a problem for the providers either. So then that led into some, bigger pilot groups and testing, and then ultimately the passage of this law in 2021. I'll pause there for thoughts or comments, and then we can continue.
Well, yeah, I mean, I guess the first reaction I had was that I think it is really interesting that none of them wanted to rescind their patient's ability to read their notes. I mean, I've definitely, since the open notes law passed into place, personally, I've never really looked at my primary care notes a whole lot. I mean, maybe once or twice, and just kind of seen like, oh, okay, they said this, and in that context, that never really feels like of particular concern, unless they were writing some kind of like I don't know, weird gossip note for the next provider or something, which I don't think really happens, but. So I have done it for mental health notes for like a variety of different reasons. Maybe it was applying for a new insurance policy of some kind, and I needed to have medical records. And I, while requesting medical records for the insurance company, requested records for myself just because I was kind of curious, like what did the provider write about me? And that was the only time where I ever kind of was inclined to do that. And it was surprisingly not that exciting, I will say. I mean, I think, different in my experience, different providers write different amounts of detail. Some of them kind of keep it general, whereas I think I read an intake note where I must have said, there was this habit that I had that I didn't like. I wouldn't say I was constantly doing it, but I had this habit, and I was like, oh, I constantly do this. And I read that it's fun. I have such a close relationship with my wife. We were like reading my therapy notes like together, and I was like, it says I constantly do this. And we always kind of joke about that, because it was like, that's not accurate at all, but it's just, that's what somebody noted down, because I maybe used the word constantly as an exaggeration one time. Mm-hmm. So like, I could look at that and kind of say like, that's kind of funny. But it did kind of make me wonder, like, I don't have a chip on my shoulder at all about reading that kind of thing. And, don't take myself too seriously, when it comes to, getting offended when there's no, there's probably no reason to be offended, but, no, it did make me wonder like what somebody else might feel, or how they might react to reading something like that they feel is like an inaccurate depiction of who they really are, that, one person at your school, university, health center doing an intake that you never saw again, wrote down one time. Anyway, there's my personal anecdote. But go ahead.
Well, yeah, and on that topic, like even before open notes, you could actually go to a hospital's medical record department and sign a release and get a copy of your chart. And if you had a different personality, you might read that and say, this is not accurate. And you could email or communicate with the provider, I want to amend my chart to say that is not accurate. Like that's totally within every person's right to sort of, read the chart and say, this isn't right. I'd like to amend it. And then it, sort of notifies the provider that the patient is, adding something to their own medical record to correct something that had been written. And, and it's good, that you didn't have the urge or to do anything like that, and it didn't upset you, and it was more sort of something to laugh about or share with your partner.
So yeah, we might be getting ahead of ourselves a little bit. I just kind of talked about like a mental health specific situation when it came to open notes, but you've talked a lot about the origin of this and how it worked out really well in kind of general medicine type of scenario. So let's talk maybe a bit about how this translated to other fields of medicine and dive a little bit deeper into mental health providers specifically.
Yeah, and before the April 5th, 2021 date came, I actually participated in some of the open notes forums and discussions that they were the government was running to train providers. And it was, not unsurprisingly, a little bit disconcerting or disheartening about, I think the data that they were using with respect to psychiatry. So the only data they had about having open notes and psychiatric records was, again, for VA patients. So these, tends to be older men, a lot of PTSD, but, a very different or unique population than a lot of the other people that receive mental health care. And specifically when I asked them about, what about open notes for children or teens, adolescents, parents' access to the records, they really had zero data on how that had been going. They didn't have anything to, look at psychiatric records in much detail, and specifically child psychiatric records. And I remember bringing up on a call, there is this billing code, a 90785, that we use in psychiatry. That's for an interactive complexity add-on code. And one of the ways you can bill that is if there's conflicts or disagreements or high tension or maladaptive behavior.
Right.
So I posed the question of like, I totally get being general, don't use, malicious terms in medical records, don't, keep things logical, direct, but you do have this bill code that you need to document the maladaptive behavior. And so, what do you recommend about that? And in a very dissatisfying response, they said, well, I heard that code doesn't pay much, so maybe just don't bill the code. To which, when I was running a large clinic, all right, maybe it doesn't pay much, but if you're billing it 100,000 times a year at $10, that's a ridiculous answer. So that story is just to illustrate that they hadn't really had solid data or experience with what to do about mental health records, except with this older VA population. Now, that being said, mental health records have always had this extra protection in being, locked away from other parts of the medical record, or if you did go to a hospital to get your records, you couldn't really get your psychiatric records. And and which I don't think is correct either. And so ultimately now for any providers, and not just for mental health, but if you do feel that you need to put something in the medical record that's relevant to the case, and you genuinely feel that it would be harmful for your patient to read that, you can designate the note as such and have it locked so that the patient doesn't have access to it. Now, you can't just click the box that says it will be dangerous or have a bad, harmful to the patient. You actually have to document in the note as well, why you believe that will be dangerous. And of note, the open notes regulation is very specific that it can't be something that you just think will make the patient angry or upset. Like, it has to really be something that poses a risk to their well-being, which is much, harder to justify. So that's, and we can talk about, strategies around the psychiatric record piece and for the documentation, but I'll pause there to see if you have thoughts about that information.
Yeah, well, I guess my biggest question is, do you have an example on hand of something that would justify that? Would justify
I think
not showing the note to the patient due to risk to the patient potentially.
I think that, the couple of cases in psychiatry where you have to be careful are with patients with a psychotic process that, where someone really believes someone is out to get them, mandating medications, people who are in involuntary treatment for mental health reasons. So, being very careful about your wording in notes, and there are strategies on how to sort of document a visit with a schizophrenic who doesn't believe they have mental health issues, but is engaged in coming to appointments and willing to continue with treatment. And we can, that's maybe a later episode too, to talk about some of those specific strategies.
Definitely.
The other case is with, some patients maybe with personality disorders or some other traits that would make them want to scan every line of the note, contradict or argue about things that have been written, and could cause a lot of psychological distress to the patient. I will say, going way back to even my training, when I used to type my notes when people were still handwriting them, I at least a dozen times would have patients who would ask about, what do you write about me, or what's in those notes? And every time I'd sort of, well, why don't you come take a look? Let's write your note together, and sort of show them that, like you mentioned, it's actually kind of boring or not that exciting. And I think, this whole mystique of psychiatry, like, oh, is Dr. Tarshis going to write this amazing secret sentence that if only I knew it, it would,
unlock the secrets to mental health. Yeah.
Yeah. So, it's very, I've always been open for sharing the information. And on that level, I can see the value. And I've had more recently, when I have patients that I know were requesting to see their records, not necessarily for anything that would be helpful for treatment planning, usually asking about what they want to see, and then sitting with them while you review the notes is a good way to sort of head off any problems with releasing records to the patients.
So with the law change in 2021, was there a general shift that you noticed in providers talking about how they needed to reword their notes?
Yeah, so we did training, and as we do training in general, that you always keep the note professional. It's much better to speak in in general terms to, sort of cover insurance billing and malpractice and be able to know what happened in session. But, if there was an argument between, if you're doing couples counseling and there was an argument between the couple and it got very nasty and mean things were said, there's no reason to, the couple fought about X, Y, or Z and the partner called the other person an awful human being. And, you could just sort of document discussion on argument, communication styles during an argument, and you can always put it in very general terms. In reality, and what we've done at RipsyTech so far is, although we have the checkbox to hide the note content, because we don't actually have our patient portal open yet, although patients can get copies of their notes by requesting it from their provider, there's not actually that easy access to your notes like there is with some other systems yet. And I think due to the nature of our field, it's one of the reasons that the full portal with note access is a little bit, it's coming, but it's a little bit lower on our list of features that we want to implement. And I think that from a provider perspective, since the patients can't just log in and read every note, I don't know if that's fully implemented the change in some physicians' documentation style or mental health clinicians' documentation style. So that I think will be the, once it's live, that, hey, your patients will be logging in and reading the notes you've written. My sense is that people who know that they're putting in too much or should alter it, I think that will be the big change initiator.
Yeah, that will definitely be interesting to see. I will say of every therapist I've ever seen, I've never actually seen a psychiatrist before, but of every therapist I've ever seen, I never once had a patient portal. The therapists I see now, there's never even kind of any discussion of like, hey, do you want to see your notes? I could just ask, but it's an interesting topic because many patients might not be aware that it's something that they could even do. I'm aware that it's something I could do, but I have no kind of desire to. But it's never even been communicated as an option. Just my consumer experience, so to speak. Okay, I want to kind of on that topic, Parker. Part of the open notes regulation is that it does actually need to be, once the ability exists, there needs to be communication to the patients that, hey, there's a new medical record available. And so, and in other, like if I go for primary care visits with my chart or at Stanford or UCSF, you get that text or that email that they're, and you probably had that also. Yeah. Interestingly, once again, in the mental health field, where 60% or so of mental health clinicians don't take insurance, if you don't take insurance, you're not bound by open notes, is an exception. Very interesting. So I did not know that at all. Wow.
So if you're a cash practice, you are under no obligation to release the notes to your patients. And second, if your current record system doesn't have that sort of easy access, you're not required to sort of do that notification of a new note, or if a patient requests it, you still need to give them the records, but you're not bound to the other rules of open notes unless your record keeping system has them active.
Interesting. That is really interesting. I wanted to rewind to something that you said. You were giving an example of a couples therapy note. In that case, is it two separate notes for two separate patients? Is it ever kind of conflicting for one patient to request the notes and the other not to? Is there any kind of weird dynamic there?
Oh, good question. Yeah. So in couples therapy, only one of the couple is registered as a patient. So even if you're doing couples therapy, there's sort of one identified patient, and then you bill the session under that person's name with the right bill code to represent the visit. So only that person would really has access to the medical records.
Interesting. That is interesting. Okay.
I guess theoretically you could register both people and alternate sessions, but then that's an extra hassle to do that. So I don't know of anyone who does that.
Yeah. I mean,
Go ahead. The other interesting, so then the other interesting use case is, what do you do about adolescent records? So the other thing we're very careful about is protecting adolescents' privacy. And we know to keep the therapeutic relationship strong, once a patient is 12, 13 years old, they don't, they want to have that privacy in session and know that parents aren't reading the notes. And so, at this time, we sort of follow suit with other major institutions and then also recognizing that at age 14, it might be hard to process something that's written in your medical record, but maybe it's not that much harder than when you're 18. But in any case, we have the policy where if your age is 12 to 17, no one has access to the notes, including the patient. The patient will get access when they turn 18, but we don't allow parents to see the records of the mental health records of their patients once they're once they turn 12.
Very interesting. I'm glad we covered that, because I would never have known that. That is really interesting.
There is some data collection going around, adolescents who are hospitalized, letting them read their notes, and it actually hospitalized psychiatrically. It's actually, showing promise in that it's engaging them more in treatment. I did do a quick Google search to see if there had been sort of any open notes lawsuits, and to my knowledge, there haven't been at this point, which is good news, and showing that the whole idea behind this is engaging patients in their own care and not being so secretive. And it's good for the mental health industry as a whole to, again, work on breaking down those stigma barriers and walls and historic practices. So that's hopeful, but we don't have controlled studies or much solid data.
Yeah, wow. So I want to quickly revisit something that I said at the top of the episode, which is about how this made me reflect on something that I learned from my own grad school education, which was specifically open science. This concept of the open science framework is something that exists specifically helpful in psychological research, where we're working in kind of like a softer science, where it's this research initiative to try and get researchers to be more open about the data sets that they're using, about what their actual hypothesis is going into analyzing the data that they collected, so that way we can hold researchers accountable to not p-hacking their data into the result that they want, and instead saying, like, this is exactly what I plan to do and how I plan to collect that data. And if the result comes back that it wasn't significant, then you can report that, and that in and of itself is useful data. Anyway, it's clearly the word open is what kind of connected these two things in my head. But I did think it was interesting that, based on the timeline that I know about of why open science became such a strong initiative, was around like 2009, 2010. Somebody had written an article kind of proving that like ESP existed, which was clearly, baloney. And that's when people kind of said, hey, we need to take an initiative here. And then I was looking up the open notes, and when that initiative kind of started, and it was around 2010 where the initiative to really get going with that was starting to get going. So yeah, I just thought that was an interesting observation of just, something at the turn of the decade around 2010. We were trying to hold people in these higher positions of, medical authority and academic authority to hold them accountable to a stronger degree. And the last decade has kind of been an effort towards that. Anyway, just an observation that I wanted to put a voice to.
Yeah, and I don't know the timing of sort of the open source software movement, but I wonder, it's a whole other topic on academic medicine and centers, and that would be a good podcast. But the one thing that makes it a little harder is the fight for tenure and competition.
Right.
I could see among, oh, look at this great study. Hey, that's what they're doing. Let's do it faster and better. I could see that, and that's one of the reasons I prefer to stay on an adjunct level. But very cool topic. And I think we'll do a couple more podcasts on this. I think this topic fits very interestingly with AI scribing and other AI services, and the fact that more and more people are recording sessions, even in mental health, and that's going to be an interesting twist.
Yeah, like a shift.
Or I don't know if twist is perhaps, the right term.
It's still kind of up in the air on what, how specifically AI scribing, just the commercial application of AI in really any industry. I think we're scratching the surface of what's possible. So it's definitely going to keep getting more exciting.
Yeah. Yep. Agreed.
Okay. Well, this has been an interesting episode. Do we have a mental health business moment this week, or?
I have sort of a good, I do, like, and it's a positive
Let's
one.
go for it.
Well, and I think we may have mentioned even on the last podcast or so that we're looking to expand our nonprofit to offer services in Hawaii. Yeah. And I had completed my Hawaii medical license application, and I was ready to wait 3 to 4 months for that to come through. But in a shocking manner, 12 days after I mailed everything with a check, I received my Hawaii medical license. So I'm now a licensed physician for the state of Hawaii. Wow. And I cannot believe the fast turnaround time. And as an add-on to that, in going to, begin services through our California nonprofit in Hawaii, I was able to email someone at their, state business office on, hey, let me, make sure what is needed. And they responded in like 4 hours, like, here's the form you need to do. And that's it. And so that's like a pleasant, good start.
Wow.
Mahalo, Hawaii. Mahalo.
Awesome. That's great. Well, yeah, that is a nice little positive to end this episode on. Well, yeah, keep us posted on the continued progress of that that mission that you have out there over in Hawaii.
Will do.
All right, great. So let's cap off the episode here. Thank you for joining us in this week's episode, Sit and Stay podcast, brought to you by RipsyTech. As always, if you have any questions you want to submit over to us to answer on a future episode, or you're interested in applying to be on the show as for one of our guest episodes, send us an email at sitandstay@ripsytech.com. All right, Tom, it's been great. I will see you later.
Thanks, Parker.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at ripsytech.com.